Good evening, I'm Professor Mark Ashton. I'm a specialist plastic surgeon based here in Melbourne. And I wanted to go through, if I could, just some of the basic characteristics of the modern day implant. The implant I'm holding in front of you is what's called a textured implant. What that means is that it's got a textured surface. And these texturing can either be of two types. It can either be like this, which is called a macro texturing, or alternatively, I can have an implant like this, which is similar, but the texturing is much finer. The reason why that's important is because recent literature has shown that if we have a micro-textured implant, it tends to be a little bit safer in the longer term. These implants are incredibly strong. If I grab an implant, this is a smooth implant, you can see, because the implant itself is very smooth indeed, but they're really, really strong. I can't break it. And even if I were to, say, fall on something sharp, or if there was to be some problem, when we look at the inside of the implant, we see that this is an implant which I've cut in half. You can see that the gel inside of the implant here is very cohesive. So the implant manufacturers use different names for these. So this could be what's called a form stable, or a cohesive, or a gummy bear gel. It's all pretty much the same. There's just varying degrees of cohesiveness, or how much cross-linking they have. In every case, you have the implant is filled up with this gel on the inside, and then there's this silicone liner on the outside. What that means is that the implant itself is very, very stable and very, very strong. You might have heard of one other type of implant, and that's a polyurethane implant. Now, these implants are really quite different to all of the others. They're covered by a polyurethane texture, which makes them very furry. And we tend to use these in that situation where we're trying to deal with a pre-existing medical problem, say recurrent capsular contracture, or an implant which tends to prolapse and move into a different part of the breast to where we want it. So when we put these implants in, they're very, very sticky, and so therefore they're difficult to use, but they often can get us out of a problem situation where the other types of implant simply won't do the job for us. If you have any questions about the different types of implants or would like to explore this further, please don't hesitate to contact our rooms. The contact is on the bottom of this webpage here, and we'd be only too happy to go through these with you.